Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Isn't that a surprise, Brad? Okay, today we're going to talk about calf pain or calf strain. This is an injury that you may have incurred from like tennis or from running uphill or any sport where you're doing a lot of accelerating and deaccelerating. They actually call it tennis legs sometimes, Brad, because it's so common. A lot of people refer to the calf muscles as kind of the motor of running, because it really provides a lot of the engine support.
Right. It's the connection to the ground forces you halfway. And
now this is a very common injury among weekend athletes, and this is the best treatment you can do for it. Believe me, we're physical therapists. This is the best thing you can do. Especially this is good for one that's been kind of nagging and still and just won't go away. You've been maybe even already resting, and it just keeps coming back. Because what happens is right after the injury, there's scar tissue being laid down. And that scar tissue is kind of forming almost a web. That's what you called it, right, Brad?
Right. It's not in orderly fashion.
Yeah, it's not an orderly fashion. And because it's this way, it's not very strong. So you got to have it heal strong. And by doing this type of massage, this particular cross-fiber friction massage developed by Cyriax, this will help strengthen it. So believe it or not, this should go away within 2 weeks. If it's chronic, maybe 4 weeks at the utmost. So right after you injure your calf, let's say you just injured it, I would say go ahead and do the price: protection, rest, ice, compression, and elevation.
Right.
But within a day or two, I'd go ahead and start doing this massage.
If it's too tender, wait.
Right, and we'll go over that. We'll go over it. So okay, what you're going to do, if you have somebody to help you, great. If not, you're going to do it yourself. Just roll up your pant leg. This is my involved leg, we'll say. All right, you're going to go ahead and sit kind of in a cross-leg fashion here. And generally the injury happens on what we call the medial gastrocnemius, which is on the inside part of your calf, near the other side.
Right.
And so it's right up in here. You'll find it. It's going to be the tender spot. It's right in the belly here. And what you're going to want to do is you can take your two thumbs. It's actually better if you can actually take your fingers like this and have somebody do it. And you're going to find the spot and you're going to rub real deep back and forth like this. Now, if you start doing this and it just gets worse and worse and worse, just tender, I'd back off, go ahead and ice for another day or two, and then try it again.
Sure.
But if it starts feeling like it actually starts to get a little bit numb after a while, let's say I'm going to do the two thumb technique now. I'm going real deep. I'm not just moving the skin. I'm going deep down into the muscle, and I'm breaking up that scar tissue so that it can heal strong now. And let's say I do this for like a minute, and it actually starts to almost feel numb. That's a good sign. That means you're doing the right thing. So again, you can do the 3 fingers, but I'm going across the muscle. The muscle fibers run this way. You're going to go across the fibers like this. And Brad, believe it or not, as a therapist, you could do this for 20 minutes.
Right.
That's how much Cyriax would recommend. I wouldn't recommend doing that to start off with. I would maybe just do 5. And the first time you do it, you can do it 3 days in a row if you want. But then after that, I would do it every other day.
It's going to be getting better if it's the right thing.
If it's the right thing. And again, if it's probably an acute injury, meaning it just recently happened, this should be, you might be back on the tennis court in 2 weeks. If it's chronic, it may take you 4 weeks to working this every other day and doing the 5 to 10 minutes, maybe even more if you can tolerate it. I don't know, your hands probably won't hold up that long.
Right, 5 minutes and your fingers and my knuckles are pretty darn sore.
But you're going to be surprised how well this works, and most people.
Right.
And make sure that's, of course, what the injury is that it, because generally what you've done is you've torn a few of the fibers of the gastrocnemius. If you've really tore it to the point where it needs surgery, you won't even be able to
It's going to be tender.
It's going to really be bad.
So do we stretch a little bit with this, Bob?
We're going to show you this too, what to do after. We're going to do the top 3 exercises you should do after the pain has gone away. One thing as a recommendation, before you start doing this, and let's say you're having trouble getting around, do you want to hand me that paper towel, Brad?
Sure.
One thing you want to do to take a little bit of stress off the calf is to actually put a wedge in your heel. And you can buy one of those Spenco, isn't it Spenco?
Right.
Heel wedges. Yeah, and you can put them in there, or you can just make your own. You just I took 3 paper towels here, I folded them up, And you can see how this creates a little bit of heel height, a heel wedge.
Lift, I call it a
Heel lift. There we go. I'm coming up with the term yet. All right, you just put your shoe, take your shoe off, you put it in the heel of the shoe, and you can slide your foot in, and that's going to raise your heel up a little bit so there's not as much stress on the calf while you're going through this phase of trying to get it to heal stronger. So that'll give you a bit of a little relief until you can take the pain away.
Right.
These are real comfortable, Brad.
Oh yeah, I believe you, Bob.
I'm going to put Spanko out of business. I'm going to go ahead and get the Schrupp heel wedge lift.
Yeah, it's amazing what you can do without spending any money and get good results.
Yep. All right, if you haven't already, you're going to want to subscribe to us because we're going to give you hints on how to stay healthy, fit, well beyond the age of 40, way into the age of 50. Brad, what are you, 52 now?
Yep, all the way up to there.
52, wow.
And actually do other videos for your grandparents and if they're great-grandparents, so keep us in mind, famous PT and...
I have trouble even believing he's alive yet.
Yeah, it's...
all right, good luck to you.
Though.